When someone in your family isn't feeling well,
It changes everything.
and it never happens at a good time.
That's why we're here, Monday through Saturday, 10 to 7.
And on Sunday from 11 to 5.
The clinic at Walmart, operated by St. Vincent.
No appointments. Just stop by if you're in the store or in the neighborhood.
Quality health care for the whole family.
Affordable family care.
On your schedule, 7 days a week, the clinic at Walmart, operated by St. Vincent.
Welcome back into Good Morning Arkansas on this Friday, and Dr. Greg Dwyer of Little Rock Dermatology joins us today. Good to see you, man.
Good to see you.
Yeah, thanks for being here. And we want to thank St. Vincent for making these great doctors available for us and for you to answer questions that you may have. And if you have skin cancer questions, 1-866-GMA-TALK is the number. Hey, this is the time of the year. I think everybody is outside. We're wearing short sleeves. More skin is exposed. We've got to protect ourselves, don't we?
Yeah, I think the biggest mistake people make is they don't put enough sunscreen on. So we recommend you use an SPF of 30. And to cover the exposed areas, it takes about 1 ounce, which is like a shot glass full of sunscreen.
Wow.
So that's what you should think about.
A lot of it then.
Yes.
Are we underdoing it? Probably
yes.
more often
so
than
if you're
not.
putting an SPF 30 on and you're not putting in enough, you may be getting an effective SPF of 3 or 4. So you need to put enough on.
Wow. And reapplying, I guess. We sweat.
Every 2 hours you should reapply.
And that's okay. All right. Well, good advice. Hey, what about screening? What are the ages we should start to get, and how frequently should we get those screenings?
Well, I think you should start younger, maybe age 30 if you're fair complected, you burn easily, you never tan, you have a family history of skin cancer. Otherwise, 40 on up, I think, is when we start seeing more skin cancers. I think once you get to 50 and above, you should be seen every year and have make it a point to have a total body skin exam.
And obviously, if you have some spot on your face or somewhere on your body that begins to grow or to...
You have something that sore that won't heal, a place that's bleeding or itching or changing colors or shapes, all of those need to be checked out.
Okay, some warning signs right there. I think we have a caller on the line. Carmen from Jacksonville, you are up first this morning for Dr. Dwyer. Go ahead. Carmen, are you there? Carmen was there. Oh, hello, Carmen. I think we have you now. Go ahead with your question.
I've had 2 types of skin cancer. The one that I had was on my nose, and they had to do surgery. And then I had but I can't remember what type of cancer that was. I know it's a skin cancer. And then I had one on my leg. And my question to the doctor is this genetic from your family? Because I keep getting them, and I've got another one coming up again. So my question is, what can I do to stop getting skin cancer?
Well, there are definite hereditary factors. So we do see families that have multiple skin cancers. Some of those start as early as age 20. If you have a fair complexion, you burn easily, light-colored eyes, family history of skin cancer, you've had a number of sunburns in earlier years, that increase your risk. So we advocate using a sunscreen on a daily basis. We don't want you to tan. We don't want you to go to tanning bed. You can go outdoors, enjoy life, but just be skin protective and cover up. And someone who's had cancers should definitely be followed on a regular basis. If you've had 2 skin cancers, you are a much higher risk to have a third. So you definitely need to have your skin checked on a frequent basis.
All right. We had a couple of other callers on the line. We weren't able to get to you today, but great advice. And I think a good question there about genetics and just about protecting yourself. I want to thank Dr. Dwyer for coming in here. If you'd like to get in touch with him, and maybe you have some of those questions, we weren't able to get to them. Little Rock Dermatology is at 500 South University, Suite 301 here in Little Rock, and there's a phone number on the screen. And again, we want to thank St. Vincent for bringing the doctors here every Friday. You can get some of your medical questions answered right here on the show. Hey, have a great weekend, everybody.
Thank you.